Wow, there's so much going on in hospital pharmacy, but I would say right now, looking at the drug shortages, impacting us every day.
The top two things I would say that are challenging in the state are shortages and back orders that we have to deal with on a daily basis.
We recently had everybody is worrying about inventory and trying to maintain supply of drugs just to take care of patients.
Today, shortages, absolutely, is a big thing that we're tackling, that we're currently working on. I'm sure everybody is. Drug cost is something that we are currently working on as well, along with the shortages. I guess that goes hand in hand.
The second issue to me is related to the integration of hospitals and health systems with all the mergers and acquisitions and trying to establish a system of practice throughout all of these hospitals.
And then automation and technology is basically what we're looking at.
And then the second thing that jumps out at me right now is inventory control from a system level scope as well as in the hospital setting, making sure that our PARs are set right. We don't have a bunch of inventory sitting on the shelf. We don't have things there that we don't need. Call it just in time if you want, but it's really more just making sure we're being good stewards of our resources.
So the top two things I think are impacting hospital pharmacy as a whole are the fact that we're trying to expand clinically, but we're being forced to contract financially.
Maintaining inventory control and cost containment while keeping that quality level is probably what's most important to me. Aside from that, integration is extremely important to maintain the continuity of care for our patients as they move from inpatient to outpatient.
Improving quality and decreasing cost of care to improve the value to our patients.
Well, first of all, I think that the changes in the dynamics of the health sciences workplace is certainly the first thing that comes to my mind. We've had so many changes occur over the course of the last 2 or 3 decades. The influx of technology, changes in reimbursement, requirements, both federal and otherwise, have really made these environments extraordinarily complex.
For us right now is trying to leverage technology and automation. That's the key to the future to staying sustainable and staying successful, so we've worked pretty hard to do that. It's also developing people, making sure we've got the right resources in the right places to run our services, make sure things are going smoothly and making sure things are running up to par. And so from a challenge perspective, those are probably our top 2 right now.
Right. So one of the 2 big things that I'm working on and looking at is how can we elevate some of our pharmacists and have them work at the top of their license. And to really do this, we're looking into automation and how to take some of the daily tasks that we do and typically have somebody work on and automate that so that it frees them up to do higher level functioning and actually practice in a position and do items that requires a pharmacy license.
Right? I think about it. We shouldn't have patients in the hospital if we do a good job in prevention and managing chronic diseases. And so a lot of the other things that I think are really critical is to see how during that episode of care in the hospital, we can prevent that patient from having to come back.
When you hear the word pharmacist and pharmacy, they really think of the outpatient in that realm. And really having the pharmacist integrated within healthcare at every touch point. And so looking at the infusion centers, the ED visits, and the hospital stays, and really having pharmacy be a staple as part of that patient care visit and seeing the value of that.
The influx of new pharmacists into the space.
First thing is safety, and second is the patient is always first.
Very likely regulatory compliance. Things are changing drastically every single day. Making sure that we're doing what we need to do, both to treat patients, but to do it in the safest and most effective way. Efficiency is also part of that regulatory compliance. I think that's expected in the healthcare field anymore as payers change to fees for quality rather than just for service. We have to make sure we're doing it in the most financially feasible way possible.
One of the biggest is the FDA barcode rule. I was involved in helping to push that rule in 2004. We were happy to achieve a linear barcode that included NDC number. We had hoped to also have in that barcode lot number and expiration date. Linear codes could not contain that much information without being a foot long. I believe it is critical that our barcodes on all immediate drug packages have lot number and expiration date added.
And so as a consequence, when I think about the top two things, it's really an amalgamation of a whole host of things coming together that make for a very, very complex health sciences enterprise.